about. Oh, no, I'm not working. Next slide. We now work in 4 focus areas. These are healthy bodies, healthy minds, community health, and health equity, and championing health equity. I won't go through all of these, but I did want to mention that our food access and security priority falls under our strengthening community health focus area. And the strategy here is that we are investing in quality food and affordable housing to create a foundation for which communities can develop locally specific solutions that lead to health equity. So this was really our social determinants category. We considered a lot of different options here, but where we landed was really prioritizing food access and security, as well as affordable housing, and promoting work that supports communities in developing their own solutions to addressing health. In our food access and security priority, our goal is to ensure that Coloradans have enough affordable and nutritious food. And we then have 3 objectives under that priority. The first is to increase the efficiency and effectiveness of collaborative community-level efforts to reduce food insecurity. The objective here is really focused on supporting partners to better work together and to align their efforts to address food insecurity at a local level. The second is to increase participation in public food assistance programs among Coloradans who are eligible for them. Here, when we're talking about public food assistance programs, we're referring to SNAP, WIC, CACFP, school lunch and school breakfast, as well as the summer meal program. And this really aligns squarely with what Workgroup 4 and 5 are focused on. And our third objective is to support public-private partnerships to increase the prevalence of affordable, healthy food and beverages. So this slide is a lot to take in, and I apologize for that. You don't need to absorb it all, but what the visual is intended to show is that our 3 food access and security objectives really align with the goals, the 5 goals of the blueprint. All of our objectives do fit into one of the blueprint goals, but they don't necessarily encompass the full scope of the blueprint. So our first objective around community food programs aligns with goals 2 and 3 of the blueprint. Our second objective around food program participation really aligns with goals 4 and 5. And our third objective aims to increase access to healthy food, aligns with goal 2. So the arrows here are bidirectional in nature and are really intended to demonstrate that we see a mutually beneficial relationship between the funding of the Health Foundation and the work of the blueprint. We expect that learnings and outputs from the work groups are going to help inform our funding and policy work moving forward, and vice versa. We hope to be able to make strategic investments to help support the work of the work groups as we move forward. I also want to highlight, and hopefully our objectives show this, but we are very committed to community engagement as well as to systems change, knowing that ending hunger in Colorado is really going to require both strategic grant making, local level investments, as well as private sector partnerships. This is also a busy slide, and you don't need to take it all in, but just wanted to touch a little bit on some of the things we're currently doing and what we have planned for 2019. Supporting the implementation of the Blueprint to End Hunger through the program office, which is housed at the Trailhead Institute, is definitely a core investment, and we really see that central to helping to coordinate all of this work moving forward. But it's not the only thing that we are doing. In June of last year, we launched our responsive grant making program, which is intended to address urgent community needs, as well as emerging opportunities to test out innovative approaches, implement proven practices. So with this program, with our responsive grant making program, we're not asking applicants to apply to us through a specific funding opportunity, but rather to bring us their best ideas about how to achieve different things. And we had this open in June and October, as well as February, June and October of last year, as well as February of this year, and anticipate we will continue to fund food and security work through our responsive grant making program. We've had some exciting stuff come through that program already. For example, under Objective 2, we were able to fund the Colorado Springs Food Rescue to stand up a community-driven neighborhood food center. We also recently made a grant to the Colorado Center on Law and Policy to expand their SNAP advocacy program. We've also made some larger strategic investments We made an investment to the State Department of Human Services to help support SNAP outreach and enrollment and to draw down federal dollars. We were able to help bring nearly $2 million into the state this past year for SNAP outreach and enrollment. We also have funded the Department of Education through a planning grant. They came to us and said, we really want to think about what it would take to address all of Goal 5 within the blueprint and what we can do within our authority as the department. So they are off and running on that planning grant, and we expect we'll be supporting them in implementation as well as we move forward. We also, several years ago, launched the Colorado Fresh Food Financing Fund to increase healthy food retail and are looking at ways to potentially continue to expand that program. In terms of specific funding opportunities, we're in the final year of our WIC Innovation Initiative, which supports 12 local public health agencies around the state to implement best practices around WIC enrollment. And we're considering what the future of that might look like and if there's an opportunity to think about SNAP and WIC and other programs more cohesively. And we also, I believe it was just last week, launched a new funding opportunity that is intended to help local communities and coalitions plan to address food insecurity at the local level. So that is for our June deadline, and really excited at the interest we're already hearing from communities and excited to see what comes in through that funding opportunity. And as I already mentioned, I think we're really looking to the work groups, this work group and the others to think about what are some of the other things that philanthropy can help support to drive forward the work that we're trying to achieve, and hope that we can continue to tailor our funding to meet that need. And finally, I just wanted to mention a little bit, in addition to what we are funding, how we anticipate working with the program office moving forward. I think you all know that within the program office, we've seated a governing council that really is serving as the board of directors for all of this work and oversight. A couple of people have asked us why we are not sitting on that governing council, and I will say that was a very deliberate decision that we made as an organization. We're very much involved with the governing council and anticipate we'll have a lot of conversations, but we didn't want to necessarily be guiding or leading the work or unintentionally having our vote potentially carry more weight. So we thought it was better to take a step back from a formal seat. I will say that not having a seat does not mean we are stepping away from the work at all. We are 100% committed to the work of the blueprint. We set out a 5-year time frame for the work of the blueprint. We are committed to funding the program office as well as to funding grants in support of this effort for the 5 years. We're really excited. I know interviews are underway right now for the blueprint implementation director. I believe that position should be filled in the next couple of weeks, which is very exciting. I think, and then at the work group level, members of the Health Foundation will be participating on the ground on all of the work groups as well. So again, I just wanted to emphasize we're very excited about this work. We're very committed to this work. And we know that Health Foundation support alone is not going to support everything that needs to be supported. So as we're moving into implementation, we are going to be really working with Colorado funders as well as national funders to hopefully bring other resources to the table. And that is our vision, to have this be not just Colorado Health Foundation dollars, but other dollars coming into the state and continuing to focus the energy and excitement of this work. So I think that's all I wanted to tell you. Any questions about what we're doing, or certainly if you do have specific questions about our funding, happy to take that offline, or my colleague, actually I should show that. My colleague Dara Hesse, I don't think she's sitting in this work group, but she's the senior program officer overseeing the portfolio of food insecurity work. So she'd be your point person on the grant side. I sit on our policy team, so I'll be working on some of the policy related activities and helping to raise awareness of this work with the state legislature as well as the current administration. And Kyle Sargent is also a program officer working on this portfolio of work. So feel free to reach out to any of us at any time. Thanks.
Great. I think that's very helpful, Alexis. Thank you. Just to give folks a sense of the role of the Health Foundation and the work moving forward. So this morning, as we have been with the other work groups and thinking about how we continue to move our work group forward. We're going to have some information brought to the table this morning about some current opportunities and things to think about. We're also going to talk broadly about some priorities, specifically from this work group that we want to move forward, and have some time for discussion today. So I'm going to hand it over to Jennifer and Michelle to take us forward.
Thanks, Cindy. I also wanted to thank Maddie, who is our chair, and put a great deal of effort into planning this meeting with us, but has to join us from the phone because she's sick. So thank you, Maddie, for all of the work that you've done. What we're thinking about today is kind of providing a little bit of information on what are successful components, what are the components of a successful public campaign, and then we're going to have a discussion about how this group, we'll split into a couple groups and have a chance to actually dig into some actionable items. And then Kim Milbrath from American Heart Association will kind of walk through and do a crosswalk around their successful campaigns and what that might look like for us. But what I was really hoping to do during this time, I've been presenting on the blueprint for over 1.5 years in the community, and that has been a very energizing and positive and wonderful experience. And what I've found is that every time I have a different audience, and this could be anywhere from Gerontological Society to a community in the mountains who's bringing, like Garfield County, there were 55 community partners. Mesa County, there were 65 community partners. School nutrition conferences, family resource centers, the Suicide Prevention Commission, kind of wherever I'm talking about this, people are very surprised because we haven't been talking about hunger. So they're surprised at what we're showing them, what the facts are, the extent of hunger and the implication of hunger. And in your packet, you'll see a slide deck that I use. It's always also made relevant to the audience. So there's always other slides in there, some background information. But the information that's in the blueprint that's also in your packet really helps guide the conversation. And what we're finding is that people are surprised, but when we're presenting the impacts and then the potential solutions, folks are really, really excited and they want to know more. They want to know how to talk about hunger, how they might engage with the blueprint, how they can help normalize the conversation. They're really asking for collateral materials and some training and just ways that they can engage. And when I think about all of that energy that we could harness, we have to make it very easy for folks who this is not their bailiwick. This isn't their purview, but they're very, very interested because they see the cross connections with health and early childhood education and seniors and their community and the economy and all of those things. And we have different levels of requests that, again, one is just how do we normalize the conversation and how do we make it relevant, and where would we find, so it's really interesting. Every time people are like, oh, why is SNAP and WIC enrollment so low? And how do we, what do we need to do to be able to increase that in our community? Because people are very shocked about that. So there are a couple things. Workgroup 4 is working on SNAP and WIC outreach, and we have a toolkit that's been funded and is in development. But people that want to have consumer-friendly posters that really talk about SNAP and WIC in the frame of health, because that's how the information is being presented, and that's how they feel some of those messages would resonate better in their community if we really flipped the ideas around SNAP and WIC into nutrition. Right now, you've got the existing slide deck. We have a video that we haven't released yet. So these are existing resources. We have a few fact sheets. We have the website, and we have an interactive map by counties. Now, those are things that we've done through our contract with Michelle and her team. But what we could do as a group is prioritize some other things that are very low cost using the resources that we currently have. And I'm going to walk you through some of these, but certainly getting something out that is very accessible around public charge. And we have examples from other states that, again, is very accessible. Doing fact sheets by sector and population. So really helping inform early childhood, for instance, about why this issue is important and how they might engage. The healthcare system. So it's very easy for folks to get something that is relevant to them. We have talked about, and Michelle can add on to this, recorded webinars that we've talked about, doing a Blueprint 101. Some people are still watching like a video of me at the launch, or a video of me like where I didn't know I was being videotaped, and it's sort of not like the one we want out there, you know, like I don't mind doing one, but I'd like to be dressed up a little differently, and you know, like the angle's got to be right. But certainly we've also talked about regional education forums that we could begin to kind of put out there, and additional videos, short clips that would, again, make it accessible, make it short, really engage different sectors. Okay. So I'm going to walk through just a couple of things that we've done. This was really, Michelle did an amazing job putting together facts for Governor Polis when he was doing the PSA about 5 weeks ago. We were able to put together information about what is SNAP in Colorado, and then what does the Feeding Colorado Network do. So that he had a quick level set before he did the PSA. And these are, again, are some things that we can work as a group and try to prioritize. We did it with existing resources, but we haven't really done anything with this, you know, with the larger community. This is an example of something we could do, and I think we actually need to do very quickly. This is from California. We can, I can call them tomorrow and ask them, can we steal your language? And they would be able to say yes, because we have a great partnership, and it's in English and Spanish. But what we need to make, this needs to be made available to all the folks around the state that have an interest in this and a concern about this, that it's easy to understand. People can co-brand it with their organization and with the blueprint. But what I'm hearing everywhere is that folks don't have easy access to these things. So again, this is just a great example of what is available in other states that we could do. These are just outreach posters. These are a little wonky, but again, this has come up in some of our work group discussions. You know, why do people not get SNAP, right? So this is the one on the right is from the National Council on Aging. Again, very well funded. It's a great advocacy organization. They've developed this. You know, we can take some of the information and use it in Colorado. You know, there is some debate about whether we should not be doing myth and fact, because people can kind of get those confused, and we just, you know, work with facts. On the other side from Oregon is, you know, when you do SNAP and WIC, you have to do a couple of things. One is have some engaging posters that are relevant, and then you also have to have some information about eligibility, and they don't have to be on the same poster, because it generally can get, then it looks more governmental. It's more difficult to understand. So what I wanted to do is talk about two campaigns that I really like, and this. You can go on Partners for Hunger Free Oregon. We can send you that link. But they have 7 different posters in English and Spanish with different populations and different messages. Some are about healthy food. Some are talking about SNAP as an entitlement program similar to Social Security, so that people understand that it's something that's paid in, that it's capped, that it gives folks a choice. So where to buy and what to buy, and that it helps stretch household budgets. So there's different posters. It's easily accessible. We don't have anything like this in Colorado. You can't download a SNAP or WIC poster. Yes.
Sorry. We have a couple of WIC posters.
What's that?
We have WIC posters.
Yes. Yes. But are they more? They're more technical rather than this, right?
No, we have some newish ones.
Okay, good. Okay, yeah, that'd be great, because I think some of the ones that have like eligibility criteria and more of the things you have to do, they don't necessarily frame it as a health and wellness, and so I think I'd love to see yours, but that's what's missing.
For SNAP, we'd also be willing to share the materials we have through our outreach partners that are similar. These are really beautiful. There could be some opportunities for improvement, but we do have some materials as well. Yeah,
and some counties have made their own. What I think folks would like to see around the state, what I'm hearing, is uniform, a campaign around it, some standardization, and the ability to co-brand and make it relevant for their community. So that's kind of what we're hearing from the field. This is New York. It's interesting as well. They have a lot of different ones. I think there's 7 different posters, and then you can actually go in and see a video that is telling the story. Like the gentleman on the left talks about how he needed SNAP and when he needed SNAP and what his life circumstances are. And so each of those posters links to a video story and again, multiple messages and population targets. We also have national partners that are willing to come to Colorado and have great templates. They have huge budgets. We have some resources that we can use and reuse and repurpose and co-brand. They have templates and communication playbooks for every child nutrition program. So they give groups like this a whole planning playbook, both on how to implement the program, but also how to communicate the program. So again, we have these great national resources that we can bring in depending on what our priorities are. The No Kid Hungry, they have flyers for each program, they have traveling campaigns, and you can see me at the Pink concert with the No Kid Hungry with my friends from Jackson Hole. I was really surprised. They had this, they were touring with Pink and had this great little thing, and then people were asking for information. So it's just, there are different ways that if we really want to raise the awareness of hunger in Colorado, we can combine some of our efforts, use some national best practice models and some standardization, as well as bring in these national partners. We're going to hear about this after we have our discussion. This is the AHA Voices for Healthy Kids. They have a SNAP incentive health promotion and health marketing campaign. It's a full campaign, and again, their staff is going to walk us through what they feel have been the successful components of education campaigns that they've run on different topics. And I know it's like CDPHE has examples of campaigns that have really resulted in public education, raising of awareness and knowledge. And when I think about this group, we have a couple of needs. One is really around raising the overall awareness statewide about hunger, which we've done in little bits and pieces. And every time we do it, we get more traction and more people interested. And then how could we support Workgroup 4 in doing a comprehensive SNAP and WIC rebranding? And does that look like partnering with the rescue agency, which we heard from last meeting? And that's kind of what we're going on. But again, part of this campaign has all of the components that we've talked about as well: messaging, fact sheets, stories, and kind of a full campaign. This is kind of what I just said. So that's the goal. The first is the vision, the goals, and then the high-level strategies. And then these are two near-term needs that I think have come out of discussions of this group, have definitely come from the field, what I'm hearing people need, what I'm hearing other work groups need, and where there might be some actionable items that this group could start to work on in the near term to help move some projects forward. I think that's all. Yep. So I'm going to leave this one up because we're going to break out into groups now to talk about, so two separate groups, one on folks who would want to develop recommendations for a public awareness raising campaign, and one a group to think about a SNAP and WIC education campaign that could be standardized, and what would be those components that we would want. And then we can elevate those recommendations to the governing council and then to funders. So that's kind of what we'd like to use our time for. AHA is going to jump on at about 11:30 and walk us through their campaign. But is there any questions about the slide deck, about how we've communicated thus far, about any of the slides I've walked through, anything about the direction we want to kind of go today, or anything you guys want to add?
Jennifer, this is Maddie. And the only thing we wanted to add is, I think we should be thinking about this as what resources maybe are out there that could help us with this, so that we don't feel like all of the people in the work group have to necessarily be creating all of these, but who could be helping us to do this? Just putting that lens as we're putting.
Yeah, thank you, Maddie. Absolutely. Some of these things are, that I first talked about with things that we could do in the short term with low cost. We can, if this work group is willing to approve some of these collateral materials, Michelle can move forward with some of the low cost, no cost fact sheets and, webinars using our existing resources, and having this work group help vet and provide feedback so then we can release those. And then there's a second piece where we know there's an actual campaign and a dollar figure. So if we would want to bring rescue agency in to do something with SNAP Ed and coordinate a comprehensive, there would be a cost to that. And there would also be a public education and awareness campaign, some of which we need collateral materials developed by an entity that's funded, and then we bring in, you know, the coordination of the resources that already exist in Colorado, the resources that exist nationally, but certainly, you know, elevating this as a need, because this group can't possibly raise awareness of hunger without a paid campaign that includes all types of collateral materials. That's what I think CDPHE can probably add in, like, you know, when you have the campaign that's been developed, there's then paid media, and there, you know, so there's this whole piece that we need to think through that is not going to fall on this group to figure out, but rather what would be the recommendations that we push forward to get a funded project for this, and then be really active in that funded project, but not have the expectation that we would do the creative and the actual proliferation. So I don't know if you wanted to add anything, Abigail.
Yeah, I mean, are you talking kind of just in terms of the steps of the process that we've used in the past, or?
Yeah, I mean, I think, you know, what have been successful, just parts of your campaign, and how have you gone about getting that vendor and then the proliferation piece?
Yeah, so usually kind of the steps of the process that we take at the state is kind of putting together an outline of what we would expect. Almost all of our public education campaign development has kind of the same steps. We have the research phase where we define our audiences and kind of understand a little bit more about what our communications goals are. And then you kind of move into the creative development phase, creating some different ad campaigns, maybe testing them among the audiences to see if they're doing what you want them to do. Then they'll take those ads and kind of version them out in order to align with the different tactics that are part of a media plan, a paid media plan, which would include, you know, paid advertising, but we'd also probably want to look at some earned media, trying to get some media coverage, some PR efforts, as well as kind of online, you know, whether that's social media or website development, and then kind of wrapping that all up with the evaluation to make sure if that's working. And so we usually kind of lay out that expectation that that's kind of the process we would go through. And then I'm sure you guys probably did something similar for SNAP, but putting together an RFP. I would say through the state, it's a pretty lengthy and complicated process, and it could probably be done a lot more efficiently, not going through the state system.
Yes.
But it's nice to just kind of put out there what we're wanting vendors to do, and then having them tell us their experience, what their approach is, how they would address this work. And giving some transparency about their costs and what that would look like.
Yeah, I really appreciate that. And it kind of goes back to, you know, just the base level of what I've heard over the last year and a half is people had no idea of the extent of hunger in Colorado. And until we are able to talk about that and get that awareness, the public and political will continue to lag. Because honestly, every time I have a presentation, so much energy is generated and people want to become involved. We just need to create that pathway and to create a bigger tent. And that can only be done when people understand that this is a huge issue impacting our state. So would you guys, I think Michelle is going to...
Can I say one more thing?
Yes,
too?
please.
I think one of my struggles is kind of wrapping my head around this bigger campaign that might have more uniformed messaging that's connected with it, and just maybe crafting fact sheets or education materials with just different language on it. So it almost feels to some degree we're putting the cart before the horse if we're just crafting some fact sheets and getting the word out there. Is our goal really to craft this larger campaign around hunger?
Yeah, I think it's a both and. I think, so we've been sitting on the blueprint for about a year, and every time we talk about it, people want at least something that they can, that would be easily, like, that would resonate with the folks that they need to engage. And those are, again, go back to some of the just facts. So what is the impact of hunger on schools? What is the impact of hunger on early childhood? So I think there are some pieces that we know people need that's not paid media, that is really supporting the folks who are already interested and engaged in this, that just need more materials. And that's where I think, that we could work together pretty easily and get some of this approved. And then I think when we're talking about, I mean, when I went to New York, I almost on every corner saw, hunger is, people in this traffic jam are hungry. There was Feeding America posters on buses and trash cans and billboards, and kind of you couldn't escape the fact that hunger is a reality when you're in that certain location. And I've seen that in other places. And that's sort of where the person who's never thought about hunger, that's what the kind of a larger campaign would be. I think one of the things that we can look to is affordable housing and homelessness. So, we have 635,000 Coloradans who are hungry, 1 in 10, 1 in 11, and not to diminish it, but we don't have, we have like a fraction of that who are homeless. Like in Boulder County, my community, we have 600 point in time homeless people and 37,000 hungry people. But what you see is a very coordinated campaign, a lot of media, a lot of news stories on homelessness because it's more visible, and we haven't talked about hunger in a way that creates that interest or that awareness that then leads to change. And I think we need to get ahead of that if we want support from politicians and businesses and funders and other communities. If they start to understand, I would love for there to be a poster in every city when you drive in a county that says this is how many people are hungry in this community. It's just those kinds of things. So there is a lot of different aspects of this for sure. And again, some are going to be done by experts, and some that we can do with our own internal expertise to support the people who are already on board.
And I don't know if this is something that when we break up in groups we'll kind of get into, but one of the things that I've been thinking about, and this might be something that maybe Maddie and Kim will bring up, but I think when we're talking about big public will building campaigns, sometimes there can be the kind of desire to make sure that everybody knows about it and that it's like a general public. And I think sometimes making sure that we have very clear goals and clear audiences and clear focus in mind is really important. So I don't know if we're going to kind of discuss that as a group or that'll be kind of broken down later. But I think as we're thinking about the public will building campaign, I think, usually there are components of let's make sure that everyone's clear about the problem, but then let's also give them the solution. And I think that solution will help us then define how tightly we want our audiences. Is this a policy solution that's going to go in front of the legislature? Is this a solution where we want the business community to jump in?
Right.
And so I just want us to kind of think about how we focus that audience, because otherwise, if our campaigns are too broad, there's going to be a lot of waste with some of our media.
Yeah.
So
I agree, and I hope that comes up in the work group. I think what Maddie and I were hoping is that at least we might be able to, as a group, create a one-page recommendation as a starting point. Because what's clear in the blueprint and what's been clear as we've talked about the blueprint is there are at least some things that we can get out in the short term and that will evolve and be iterative, and as projects are launched will evolve and be iterative. But certainly even in a year and a half ago when we were sitting and doing the blueprint as a steering committee, folks were like, we need SNAP and WIC posters that talk about this as health and nutrition, and we need to raise awareness because even the people in the room didn't know that many people were hungry. So there are some things that it won't be just this one chance. It's going to be an ongoing sort of work group piece, but how do we start to actually make some of this actionable and make some recommendations so that we can get some funding to then do all of those components and have somebody help us narrow down the focus, or phase 1, phase 2, phase 3, because that's so technical that we might not be able to do it in a work group, but we can make the recommendation that we have the resources to do that. And certainly, SNAP and WIC, I would, in my mind, thinking through how do we get the highest return on investment through potentially rescue agency that's already done a lot of this work, and could they just put together some SNAP and WIC standardized stuff, which is what they did in California. They had 58 counties in California, and there was it was so fun. I saw all the logos that different people were using, and it's just confusing. Yeah, and there's so many counties and nonprofit partners that can't access any of it. They just don't know. So how do we get that out?
I was going to jump in. This is Alexis. I just want to piggyback on what Abby just said. I think being really specific about the goals and having that conversation on what is the awareness we're trying to raise versus what is the action we're asking people to take, I think is really important for this group to dig in on. I'm just thinking back. I know I don't think anyone from the Colorado Trust is here right now, but famously they funded this big public will building campaign around health, kind of around the time after the Affordable Care Act passed. And it was, but you probably can talk about this. You worked on it, and it was very broad, but there was no tangible outcome. And I don't know, it was a lot of money, and it was not focused enough to really achieve anything. So I think learning from not only campaigns that have worked, but things that haven't worked would also be helpful for this group. And yeah, I forgot you. Sorry.
That's why, thank heavens, we have experts in the room.
Hi, this is Ellie with Hunger Free Colorado. Oh, good. Okay. I can't see everybody, so I don't know. I just see the slide still. I did want to just add real quick too, when we were looking through some of the flyers and fact sheets and some of the other examples, I thought those looked really good as well. But did want to throw out, I do think we have some of these materials already, either, I know just personally for our organization, we do have information around the link between enrolling in food stamps and WIC and health. A lot of food fuels, which just highlights health impacts. I know I've seen some great, even from, the SNAP ad or from WIC, kind of flyers that they have. So maybe not the billboard and even maybe, I know we don't have posters. I've seen some other good ones. So hopefully we can pull on some of those as well and not have to completely recreate the wheel.
Yeah, I agree. And I think if we had a good firm that would look at behavioral economics, which again, the Rescue Agency and others do, and then population-specific, geographic, underserved communities, they were looking at all of that as well as what is currently happening in Colorado and take all of that in. I think that's the important step. And then to use their research base to get some things out that we're seeing other folks have. But yes, I don't think we recreate the wheel, but I think we build on the best that we have locally and build on the best that we have nationally and let the experts take that on.
Jennifer, we did have a couple questions on the chat. So Tawana asked, how do you determine if your ads are doing what you want it to do? And Shayla asked, are they tracking participation based on applicants?
Those are great questions. So, there's a lot of ways, and again, I'm not an expert on public education campaigns, but I think Abigail talked about matrix and evaluation. And do you want to jump in on that?
Yeah, sure. So we measure how our ads are doing what we want them to do in a lot of different ways. So one example is with our Colorado Quit line. We're trying to get people to quit smoking. So our big metric is, are people calling the quit line? Are they going through the enrollment process? So that our goal is we want people to quit smoking. And so we measure not just kind of the traditional ad metrics, are people clicking on the ads, how long are they spending on the website, but really, are they changing their behavior? And then we have a couple, our marijuana campaign, we've hired an external evaluation partner. And what they do is they run online surveys or telephone surveys to actually go through the process of asking people, have you seen our ads? And if you have seen our ads, have you changed your opinion or changed your behavior? So are you aware of what the marijuana laws are? Are you using it responsibly? Are you storing it responsibly? Those sorts of things. So I think a lot of it just depends on resources. There are some times when we don't have enough money to do evaluation campaigns on the back end. So we'll just kind of look at the traditional media metrics to see if, what our impressions are and what people are doing. But I think kind of the best case is you really do an evaluation to set what your goals are and then track to see if you're getting there.
Thanks, Abigail. And I think, so with tracking participation based on applications, so what I am hearing from the field and what my experience has been in doing this for a really long time, so there's two pieces of application and outreach. Well, there's more than two, but there's a base level of raising awareness and tackling stigma through a really good SNAP and WIC campaign that, again, is behavioral economics research-based, is geared towards making it relevant to different populations and folks that they can actually see themselves in that program and that as a health program. And then once people's awareness is raised, you know, simultaneously we've got folks working on outreach and enrollment toolkits that would be able to push people to resources that are currently available to help with application assistance. So one's awareness of the program is there's less of a stigma and more of an awareness that this could actually help them. They can then connect with application assistance resources, you know, Hunger Free Colorado, 211, a local application assistance person who's funded to do that. So they're very complementary, and as those two things roll out, we'll be able to track how many people are coming into different agencies that have not done SNAP applications or have not done these referrals, and I think that they're very interactive and to some degree have to be released at the same time. Again, people are like, well, we'd love to help folks enroll in SNAP, but we don't know how to talk about it, and folks feel a stigma, and so that's where this piece is really critical in driving people to want to enroll and participate in the program. Okay, so should we go ahead and break into two groups to kind of think through these two items? And then I don't know how to.
Do you want to do maybe the phone as one group and then the people in the room are the other group?
Just looking at who's on the phone. I mean, we could do three groups, have you facilitate one on the phone and then.
Sure.
Well, how many folks here would like to talk about a general public awareness raising campaign? And who would like to, okay, so there's SNAP and WIC education, and one is like a public, just generally raising awareness, and like what would be some recommendations that we could kind of massage and put forward again over time and create, so that maybe next meeting we flesh it out and it goes up to the governing council as actionable kind of initial things that we know are needed from this work group.
It seems like we might have some folks in the room who would like to do both of those groups, right, and have real expertise in both of those groups. So what if we just sit as one group here and one group on the phone, and people can sort of break it out how they'd like? Does that make sense? Because there's going to be some commonality, and then there's going to be some separation. Does that
totally
work?
Good with that. Yep. Well, we have 30 minutes until we're joined by. We have 30 minutes to do that, so I'm totally open to that.
Sure.
Yeah. Okay.
Yep. Okay, so everybody on the phone, I'm going to be joining you in a second and going in the other room, and I'm going to put you all in a breakout room so you won't be able to hear the people in person.
Okay. I am willing to chart. And again, I think a couple things I heard was, so the opportunity would be the first one. What's the opportunity? What are the components? What are the resources needed? I mean, those are kind of the three areas we would want to put together in recommendations and then bring in. Okay.
And we can move around, we can tables, you can table chairs.
Yeah, I think so. Oh, Bobby.
An audience.
that shade over there at all, or?
Oh, do you guys need this back? Are they going to be shared slides? Yes. So I want, yeah. Okay, sure, let me just.
With their conversations.
Hey.
Hey, is Kim on the phone? Oh, there she is.
I am.
Hey, Kim. So
Hi, how's everybody doing?
Good. How are you?
Pretty good.
So we have a couple of options. I can run your slides here, and then you can let me know when to move to the next one, or would you like to run them on your computer and then share your screen so everybody can see them?
I think that I can run them myself.
Okay.
We shall see.
No, it's all good. Yeah. Yep, we can see them. Perfect.
Can you guys see them? Okay.
Yep.
Great.
Nope.
Is she good to get started? And Kim,
Are
you
you ready to rock and roll? Kim, are you ready?
I am. Yeah. Do you want me to jump right in?
Yes, please do. Well, Maddie, do you want to introduce the initiative and Kim? That would be great.
Yeah, definitely. Sorry about that. So I am excited to have Kim Milbroth here. She works for Voices for Healthy Kids, which is an initiative that is a partnership between Robert Wood Johnson Foundation and the American Heart Association. And she has a great deal of experience supporting a variety of different campaigns. She also is very familiar with some of the resources that Voices has available to the public, one of which she's going to talk about a bit today. My colleague Naomi is also on the line just in case there are other questions that she can answer. But with that, Kim, I'm going to give it away to you.
Okay, great. Well, hi, everybody. Oh, go ahead.
Oh, just a quick reminder that if you are not a speaker, please mute your, I'm hearing some typing. We're hearing some typing.
Okay, great. Well, hi, everybody. Happy Friday. I hope you're having a great week so far. I'm excited to talk with you a little bit because it sounds like you're thinking about some broad work within the hunger, food security space, and we have been fortunate enough to receive dollars, as Maddie said, from RWJ to do work in that same space. Voices has been around for about 5 years, and most of that work has really centered around HFFI and corner stores. And in the last probably 2 years, 2 or 3 years, we've been focusing a little bit more on SNAP incentives. So that's where I'm going to talk. My perspective is coming from is from our HFFI work and our SNAP incentive work, but I recognize that you guys are broadly looking at hunger. So I think all of this should flow together nicely because most of our campaigns that have been working on these issues have focused on food insecurity. So I wanted to share just a few. Are the slides advancing on your guys' end?
Yep.
Okay, great.
Yep.
Great. So my background is been in tobacco control. and food access and all of the work that we've been doing around policy campaigns and Voices for Healthy Kids. And really, I come from an organizer's background. So the tools that I'm going to share with you are things that I have found really helpful when I've done campaigns. And I wanted to center our conversation within this idea that policy campaigns have an actual lifespan. And you may not enter a policy campaign in phase one. It may not be that linear, and how you work may not be that linear, but generally, I think that we have found that there are distinct phases within a particular campaign, and it's really helpful to think about campaigns that way because it can center and concentrate your work on a specific set of tasks or strategies that you should be thinking about at that time. And so I wanted to share this sort of policy campaign phases structure with you. I think from what I have seen of the work that you all have been doing, you are definitely in the latter part of the startup phase. It sounds like you've been doing a lot of assessment. You are doing this, what we kind of call, quote unquote, entering the community by pulling all of the stakeholders together to kind of figure out what you want to do around a policy campaign, and agreeing to work together and make those commitments from your individual organizations on how you're going to participate in that campaign. And it sounds like you are looking to get into phase two, which is really describing the why and helping your communities understand what the issue is, and building that infrastructure and skill set around organizing so you can pull that lever when you get to phase three, which is really when you start to talk about the actual policy solution that you're proposing, and you start to pull the levers of the support that you've built in the community and with decision makers, and showing them, this is clearly the problem we define, and this is the solution that's going to address that problem. And then obviously within any campaign that does policy passage, there's always a point in time when the policy gets passed, and you need to think about what does implementation look like. And I can say from my own experience, having done this, learned those lessons the hard way, you have to pay as much attention to implementing a policy as you do to the passage of it and educating the community, because if you kind of fall off on that portion of the campaign, I think you can find that there are unintended consequences from people making assumptions about how a particular policy should be implemented. And we've seen that it doesn't always go to the communities that need it the most. It's not always implemented in the most effective way. So I wanted to just provide a framework for our conversation and know that I'm going to really be talking about the phase two, which is describing the why and the education and capacity building that you all are looking to do some work around. So as I mentioned, you all seem to have passed or be at the latter part of the assessment and entering the community, and I just wanted to highlight that these are some of the key pieces of that portion of the campaign that if you haven't done all of these, I would recommend that you really do spend some time focusing on what everybody's going to do and agree to what those campaign goals are going to be, and start to get everybody on the same page around what messaging looks like. Those are the things that we have found we fund under Voices, really that policy phase of the campaign. So when we are working with folks, if they haven't done some of these pieces, we always really encourage them to go back and make sure that you've got everybody on the same page. You all agree on the plan that you're going to be moving forward on, and you all agree on what that timeline looks like, because it can happen where folks kind of get stuck in that education and capacity building phase and have a hard time pulling the lever to actually pressure community leaders to do what they want them to do on the policy passage. So to have those things identified and agreed upon as you move forward can be really helpful in making sure that you're actually pulling the lever on moving the policy passage piece forward. So some of the key strategies that we've seen over the years are just really effective during this planning and capacity building portion of the phase, the education piece, is to basically get a community dialogue going about the issue. For for the work that we've done on food access, we talk a lot about access to healthy foods. We talk a lot about food insecurity. We really try to help people understand that while one neighborhood may have 4 grocery stores or, you know, a couple farmers markets, not every neighborhood is that fortunate. And there are a lot of things that go into why people don't have access in their communities. And those are the areas that we really try to focus, helping people understand better and creating a community dialogue about. And that can be done through lots of different ways. Campaigns have done things like grocery store walks, where they pick a point of origin and they, as a group, walk to a grocery store and tweet along the way about what they're seeing, the obstacles that are in the way for people to try to safely make it to a grocery store, what the produce and healthy foods look like at that grocery store. Maybe they're not of the highest quality. Oftentimes it really is a long walk. It might be several bus trips. And it really shines a light on the structural challenges that people face as they try to just find food that will keep them healthy. So doing types of events that are really focused on sort of, I guess what we call soft events that give us the opportunity for community members to participate in the conversation around why food access is a challenge, why food insecurity is an issue, that bring those issues to light without having to, I guess, crack the whip on people and say, you need to do a policy change. We really are trying to help people learn what the issue is at this point. Another example that I always think is fun, because I'm from Minnesota originally, when I was working in tobacco control, this is a very Minnesota thing, we used to do no smoke-a-polkas in small towns at VFWs. And it was a really fun way for people to participate in an event that they had a good time at, but also learn a little bit about the dangers of secondhand smoke and why it's important for us to care about that issue. So that's, I always think, is a really great example of what we mean by a soft event. And then we really encourage you to, be very clear about the message that you all are sharing. You're all on the same page about what that message is. You're utilizing that message at every turn, and it will create that sort of blanket effect across the community on really helping people understand what the issue is. And then, of course, just one last piece is to, organizing is as much a science as it is an art. Sometimes we forget the science piece. So it's incredibly important to develop benchmarks to measure your progress. Some of those benchmarks can be things like you have a certain number of letters to the editor submitted every month. It can be that you are reaching out to folks that you are bringing into your database a certain number of times every month. It could be that you are getting like 3% of the population of a particular town in your database. So you know that you're reaching out to people and you're starting to build that grassroots list that's really important to engage when you get into the point of wanting to actually do the pressure around the policy change itself. So how we've done this on SNAP in our campaigns is really starting with defining the why. And this is what that looks like for SNAP. We found across the variety of blue and red states that we've done this work that legislators and the community members don't really always know what SNAP is, or they have perceptions of what SNAP is that might not be accurate. So pulling out those compelling facts around SNAP are really important to start to develop the picture of why SNAP is an important program, how it's actually used across communities, and the role that it can play in making sure that people have access to food and healthier food. And the same thing, for us, we have focused on SNAP incentives. The same rule applies, helping people understand what SNAP incentives are, how the SNAP population utilizes them, making sure that people understand that this is about changing behavior. So with SNAP incentives, we even find that people continue to purchase and eat healthier foods after they've participated in a SNAP incentive program. All of this helps educate people about what the issue is around food insecurity and why some of the programs or policy changes that you're working on are important to helping solve that issue. So I wanted to share just a couple campaigns that I think are really illustrative of this with you all. And the first one is DC Green. Not sure if you guys have heard about this particular organization, but we've been funding them, probably for 4 years now. And they've done some really impressive work around this education capacity building piece that has focused on the participants in their Produce Plus program. I'm going to show you a video. Bear with me, please, because it is about a 5-minute video, but this will give you everything you need to know about the SNAP incentive program in DC, and I think it's just a really wonderful. It started right away. Can you guys hear it?
Not right
You can't
now.
hear it? Okay. Is there a way to, Maddie, I don't know if you're in the room, is there a way to pull it up from your screen?
This is Kevin. I can try and pull it up here. 1 second.
Okay, great.
Actually, Kim, we're also a little running out of time, and I wonder
okay.
if we could
can skip
kind
the
of
video.
move through, because we've had a great conversation actually before you came on, and you're really hitting on the points that came up in our conversation. So it would be great to move through this and then be able to ask you some questions.
Okay, no problem.
We'll share the video. We'll share this link with everyone on the phone and in the room.
Absolutely, great, no problem. So, so really, what I will say is that the focus of the whole campaign in DC Green, or in DC, Washington DC, comes out of this Community Champions program, and it is phenomenal to see how they have, how this group of women and men who participated in the SNAP incentive program have just taken complete and total ownership over this. By working with their own community members. This is an example of some of the things that they have done. They've done sort of a photo voice campaign, and I included the documents so you guys can see them because I realize it's a little bit difficult to read these. But these were incredibly influential in, particularly with decision makers, but also these folks have gone out within their farmers markets and retail environments and actually work with the SNAP incentive participants to engage them in this program and to create demand and to help folks learn what the SNAP incentive program does, how it helps people eat healthier. So it's a great campaign to look at, and I would highly encourage you to look at that video. The other one that I wanted to share with you is Pinnacle Prevention in Arizona. I don't know if there's a lot of similarities between Arizona and Colorado, but this one I thought was really interesting because it wasn't as grounded in community members as DC Greens was, but they did a really great job of articulating a message that worked really well for Arizona. And it was about Let's Grow Arizona, focusing on creating a win-win for Arizona farmers, families, and local economies. And that message really, really resonated with decision makers within that state. And part of the way that they were able to bring that message very clearly to the legislators, as I talked about earlier, was really focusing on keeping everybody uniformly talking about the issue by doing some partner toolkits that had one-pagers, that had consistent branding. This was another tool that they utilized to connect the dots for legislators and their advocates that they were working with, that, look, we've got farmers out here in Arizona that are producing healthy foods. We're just not connecting the dots between farmers markets, families who need that food, and grocery stores where they can get access to that food. So again, I included those pieces in the email. You can all see those hard copies themselves. And then I wanted to just share a few resources that we have developed around SNAP incentive campaigns, and these are available for anybody and everybody. We've got a fast facts document that I think is really thorough on incentives. You'll find some information there that's broadly around food insecurity that might be helpful. We've got a toolkit that has example, letters to the editor, social media, things like that that you can use. And we also have a success stories webpage, so you can look at that and read a little bit more about some of the various campaigns that have happened. And then finally, this is really specific to SNAP incentives, but we do have an affinity group that meets on a monthly basis. It's anybody and everybody who wants to join that call. You don't have to be a Voices for Healthy Kids grantee, but we have developed a Google Drive that's got a lot of really practical tools like legislative language, testimony, fact sheets that campaigns have utilized, so you don't have to recreate the wheel, and a lot of great other information that might be helpful as you guys move forward on your campaign. And then I'm going to stop there and open it up for questions.
Hi, Kim. This is Max from CDHS. Thank you for your presentation. I was curious if you could just clarify for me, has this campaign gone out in Colorado, or were you just giving examples from other states?
Just other states. I'm not aware, Naomi, you may be aware of some of the intel on the ground. I'm not aware of anything that's happening around SNAP incentives in Colorado as of yet, but I would turn to my colleagues at AHA who might have more information.
Thanks, Kim. Yeah, there's nothing actively going on around SNAP incentives in terms of policy work, but we thought given the focus of the Blueprint for Hunger and in this particular work group, that Kim would be great to kind of speak to how other communities have used education and awareness in building out their policy campaigns. So yeah, that's kind of the extent of.
Okay.
Yeah.
Thank you so much. That's helpful.
Of course.
And I think we could probably make some really good connections with some folks that are doing this work in Colorado with Live Well and then some local communities. On slide 3, you were really can you go to slide 3? Because this is something that came up in our discussion. So, you know, we're trying to identify what the kind of highest level message is, because, you know, one of the things we're talking about here is that folks are not really even aware of the extent of hunger and the impact of hunger in Colorado. When you were kind of in this phase, especially kind of agreeing on strategies, roles, timelines, financial, staff resources, how did that come about? You know, so, you know, we want to move into that that space so that then we can, you know, potentially write an RFP or even, you know, bring someone in to help us, you know, figure out what we need to figure out. How did you guys work on some of this piece, and who kind of guided you through that process?
Yeah, so we have a fairly, and Naomi can attest to this, we have a fairly robust campaign planning process that asks a lot of questions that give you some idea about readiness of a state to pass a certain policy. It requires you to talk about the coalition partners that are at the table or that need to be at the table. So it's a planning process that really walks you through a lot of the detail. And Naomi can talk more about this, but we require that as a template for us to see. Well, all of our applicants have to apply, have to fill that out, so we can see where the state is at, where the coalition is at, how they have thought about messaging, and that could be a helpful document if you all wanted to look at something like that.
Yeah, I would just add, it's very robust and takes a lot of time to fill out, but I think it really helps in doing the necessary thinking and brainstorming and just strategizing on, you know, if a policy solution truly makes sense for a community, and also determining if that time is the right time to do it, and if not, helping you in taking a step back in terms of like, do we need to do more education? Do we need to bring different stakeholders in? So it really kind of challenges you in your overall thought process around if an issue is timely and ready to move forward on.
Yeah, I think we're definitely in the readiness phase and the action phase. We're just trying to figure out, it's not really policy as much as it is that level setting that hunger is super prevalent, and the impact of it, and kind of trying to figure out where to start with that for a public education campaign.
Yeah, and I would say it's definitely not a document that one organization fills out and brings to everybody else. It's something a process that I would highly encourage you to do together. So you can really suss out who can do what and what seems realistic.
And when you talk about like I think you called it a planning group within, are those all paid staff that are internal to AHA and Voices for Kids, for Healthy Kids? Are those, internal resources that you already have, or are you going into, a community partner frame?
I would encourage or welcome Naomi to talk a little bit about how you've done it in the past, Naomi, as a good example.
Sure. Could you repeat the question? I'm sorry, my computer was acting up. So just trying to talk about like how we've kind of come together, how I've come together on different policy issues.
Well, part of it is, so, we're trying to do a crosswalk here, which is really like a campaign that's very, very broad rather than a certain policy. And when you're talking about, your own pretty robust internal planning process, I was wondering if those were all sort of paid internal resources, because what we need to look at is what resources will we need to bring in to make this successful for the folks who aren't paid staff to really, help us guide a process forward.
Yeah, I think it's varied. So at times I've been able to work internally with our AHA communications director. Maddie and I are working on a policy campaign right now. So we've been able to do a lot of the work ourselves so far in terms of like using existing resources to develop that messaging, helping to execute like any media advocacy tactics or grassroots. We have the AHA has what we call a You're the Cure advocate database, so we can use it as a mechanism to send out emails. That said, for other campaigns, we've had to look at finding resources through Voices or other funders to help in paying for either online ads, potentially hiring a contractor to help us out. So it's really varied, but I think, in terms of your group, maybe sitting down and figuring out what everybody around the table's organizational capacity is to help in supporting this work. So if somebody has a communications director that can maybe dedicate 30 to 50% of their time, you don't necessarily need to hire an external consultant. But if you want to do story collection and organizing and nobody has that capacity to take on that work at the level that's needed to kind of garner the results you like, then it might be worth considering, all right, let's look at funding for foundations or other entities to hire an organizer that can help us in doing that work. So I feel like it's always varied, but sometimes when necessary, we need to look for outside resources to truly have the impact we have, just because there's only so many hours in the day, and also all of us are kind of working on multiple priorities at the same time. And that's it too, I think, also looking at your timeline, like if this is work you want to do over the next year, and maybe something that you all can kind of take in internally, but if it's like we want to run an educational campaign in the next 3 to 6 months, it might be worth looking at outside resources that can help you in expediting that work.
Great, thanks. We're almost out of time. I just wanted to see if there are any questions on from the call-in folks, or any other questions in the room. Kevin, anybody chatting in a question?
Not that I've seen. Nope.
Kim, Naomi, thank you so much for joining us. You've given us a lot to think about. Would it be okay for us to reach out with questions?
Absolutely.
Of course. Happy to help.
Maddie, Kim, and Naomi, thank you very, very, very much for your time.
Thanks, guys. Have a great weekend.
Thank you.
Bye.
Bring it home.
Okay. So thank you all. This was a packed meeting, so we appreciate your time and attention. I think we've got a lot of great things to think about, and some work to bring back to you in between. So we will be in touch very soon. Thanks, and have a great weekend.
I mean, group. Next week is pretty. Wait.
Like, no one